The opioid crisis has touched every part of our country. So we're here today to talk about a powerful and practical tool in combating it, physical therapy. I'm Sarah Smith, the editor of Prevention Magazine and the wellness director at the Good Housekeeping Institute. I'm here today with American Physical Therapy Association spokesperson Sarah Wenger. She's a doctor of physical therapy and associate clinical professor at Drexel University's College of Nursing and Health Professions. Thanks so much for being here, Sarah.
Thanks for having me.
Great. This is an important conversation. I'd love if we could start by talking about opioids. We know now they're not a safe cure-all. So can you talk about the risks associated with them, especially as it comes to long-term treatment?
Yeah, I think the risks long-term are obviously a lot more challenging than the risks short-term. So people are pretty familiar with the addiction and overdose and the risks those risks are pretty well known out there. Constipation is another risk that people are pretty familiar with because there are ads on TV about it.
Right.
But I think there's some other risks that people are probably unfamiliar with. Tolerance is really common, which is when you need to take more of the medication to get the same amount of pain relief. So you can see where that can lead to the addiction piece. But also if you're taking higher doses more frequently, and also the longer you take opioids, the more risk you have for the other side effects. So the other side effects, besides the constipation, are sort of feeling dull, depressed, kind of like off or not quite like yourself. People will describe it that way. Having opioid-induced hyperalgesia, which is actually having more pain because you're taking the opioids. You can get some nausea and itching and some other things like that, but for people with back pain, constipation is particularly difficult, and for people who are already kind of struggling with depression, some of the mood-related things are really challenging.
And are there other limitations when it comes to treating pain if you're just looking at opioids?
So I think opioids, they're great at getting rid of the pain in the moment, but they don't really address any of the underlying issues, and they are one tool, and they're a tool that the longer you take, the more side effects you're going to suffer from. So it's not a good long game. So it may be great in the short term, and it may feel people are very attached to it because it does relieve your pain and it does feel good in the short term, but it's not a good bet for a long-term game. So I think we need to look at other options.
Right,
yeah.
and the CDC is now recommending alternative treatments.
Yeah.
So let's talk about how physical therapy fits into that.
So physical therapy, I think, the CDC's recommendation is interdisciplinary care, and I think we at the Physical Therapy Association definitely believe that it's not like opioids or physical therapy, or that physical therapy is the treatment. We really do see ourselves as part of the interdisciplinary team, and I think we can work with people who are taking opioids, we can work with people who are weaning off, we can work with people instead of. So it can take on many different forms, and what we do is primarily education and movement. So we educate people about what we've learned about pain recently. The knowledge base has really changed in the last 20 years, and getting people kind of up to speed on what the new thinking is around pain, how we're treating it, how the new knowledge we have changes the way that we think about it and the way that we go about treating it, and then helping people with movement, so helping them do the activities they do in safer ways so that they can keep doing them.
Yeah. Good. Yeah. Let's talk about some of that new knowledge when it comes to pain, because I think that opioids, they work quickly, and people like a quick fix, right? So, but physical therapy treatment, it's not, you don't go once and then go home and you're all better, right? So let's talk about the philosophy of pain.
So I think with pain, so if you have a problem, this is really true of any chronic problem. If you have a thing that isn't going to go away, it's not going to get totally and completely better, then you need to have some tools that you can use on your own as a patient at home to help you deal with that. And you need to learn how to not piss it off in the first place, not cause flare-ups, and you need to learn how to manage those flare-ups if and when they happen, and you need to know how to stay involved, because pain can really take a lot of things away from you in life, right? You can't work the way you want to, you can't play with your kids, you can't walk your dog, you can't go out dancing, whatever it is that you like to do, it sort of takes those things away from you. And I think keeping people involved in those activities is so important. It's so important just for people's well-being and happiness, but mental health and physical health are both, both affected if you're...
So it's a mental health treatment in a way, too.
I think mental health is super important, and we know that people who are struggling with mental health or who have some mental health issues or who are living in very stressful environments or have a stressful scenario at work, for instance, we know that those things kind of feed into pain and can make pain worse, and that those are risk factors for developing chronic pain. So we do, we're not mental health providers as physical therapists, but we do use some of that knowledge base to help us interact with people in healthy ways and build healthy relationships with our patients so that we can get the education to happen. So if I have a good alliance with you, we call it a therapeutic alliance. But if I have a good rapport with you, you're going to be much more likely to listen to what I say, to think about it later, and to believe it. But I think believing it is because it kind of resonates. And if I have a rapport with you, I'm going to be better at making it resonate for you.
Right.
Yeah.
What are some signs of having a good relationship? Because it sounds like having a good rapport is an important part of successful treatment. So if someone's going in, what are they looking for?
I think they're looking to be heard. And I think, the whole idea of rapport being important, there's a lot of research on that that really shows that regardless of treatment, that treatment's more effective when there's a good rapport. So I think we can call that fact. And I think patients should feel comfortable. They should feel like they're being heard. They should feel like their provider kind of gets them, at least to some extent. I mean, they obviously aren't just met you and they're not going to know you really well, but there should feel like there's a little bit of a natural exchange. It should be somebody you feel like you can say something to. Like if you're sitting there with all these things in your mind as a patient that you think you can't tell your provider, like that's a sign that the relationship isn't going well. And it might be a sign, like all relationships, it takes two, right? The provider certainly needs to reach out to the patient and be flexible about interacting in a way that's comfortable for the patient. But patients also need to reach out to providers. I think, it takes, I spend a lot of time with some patients dragging information out of them, and with other patients, I spend a lot of time trying to sort of make sense of the information that's coming at me.
Sounds like you need a lot of people skills to have this career.
You do. I think you need a lot of people skills to do it well. I really do. Yeah.
Well, the Choose PT movement, it's a really simple and powerful message, call to action. Can you talk a little bit about how it came to be, why you think it's important?
Sure. So the Choose PT campaign was really the American Physical Therapies Association's response to the opioid crisis. So as an association, we need to do something, we need to get on board, we need to reach out to our patients and our consumers. So the Choose PT campaign is really an effort to educate the public about opioids, about alternatives to opioids, about the risks of taking opioids, and obviously about the role that PT plays on that interdisciplinary team.
Right. Okay, great. Can you talk a little bit about the training that goes into being a PT and the science behind what you're doing? I think there are a lot of people who aren't totally sure about what it involves, and so to choose PT, if you could explain some of that, I might demystify it.
So physical therapists have to go to college, go to undergrad, and take all their prerequisites, and they go into grad school, and it's a doctorate degree. So that's a clinical doctorate, which is different than a PhD, which is a research doctorate. A clinical doctorate is like an MD or a DDS, so like a doctor or a dentist. Those are both clinical doctorate degrees, and physical therapy is also a clinical doctorate degree. So that's typically 3-ish years after school, 2 to 3 years, depending. And they learn a lot of basic science. They learn about the science of pain and sort of the, what's going on inside your brain when pain happens. They learn about neurology, orthopedics. There's a huge variety of things that we teach patients and students, and then teaching them really how to apply that information, really use the information, and how to use that information to tailor treatment for individuals.
I think that's something that people do love so much about when people that I've known who started doing physical therapy treatment. It's so personal. You get not that much time with your doctor. There's lots of general information out there online, but they go to the physical therapist and suddenly it's really all about them. And I'd love if you could share what that's like, how you've seen that affect people's lives.
Yeah, so I think it's, we do form relationships, and we're typically seeing people, 1, 2, 3 times a week, depending, sometimes less than that. And so we have an opportunity to sit down there with us, usually for an hour-ish, give and take, because they're doing exercises. So we really have a little bit of time to chit-chat. Maybe you're on the bike, or maybe I'm teaching you something, but we have some time to learn, like, who your kids are and what you do for a living. And plus, because we're interested in how people move, we kind of ask a lot of nosy questions about what people are up to in their lives.
Like, what's a nosy question?
What do you do on your job? How many breaks do you get?
Oh, okay.
I might ask questions like, do you, is your job supportive if you're in pain? Is there somebody who can do, the heavy lifting for you? Or are you going to have to do that no matter what, because your job isn't super sympathetic? So we, we kind of like get into that with people too. Same at home, do you have support at home? Or if it's going to be done, it's going to be done by you, and you don't have somebody to help you, or you have somebody that's adding stress to what's going on. So we do get into like the ins and outs of people's lives with them.
That's great.
Yeah.
We have a question coming in from Facebook, so let's hear. We have a viewer named Mark saying, "How do you find a physical therapist? What's the first step? Do you need to go to your doctor to get a referral, or do you need a prescription?"
So you can find a PT at moveforwardpt.com. There's a Find a PT feature on that. So you can find a PT in your local area, and depending on the state you're in, there are different laws about direct access. So in some states, you can go directly to a physical therapist without a referral, and in other states, you need a referral, and then of course it also depends on your insurance. So some insurances require a referral. So even if you're in a direct access state, sometimes your insurance company will require a referral. So all of my students out there will be laughing when I say it depends. Yeah. But that's the answer to everything.
Is that something you say a lot?
Yes.
What else is that the answer to?
I think it's, if you ask any PT student across the nation, they'll say it's the answer to every question.
Oh, okay. So like, what am I doing wrong and why am I in pain? It depends.
Yeah, or they'll say, like, what's the right thing to do? And it will depend on, well, what does that person do for a living? What is your patient willing to do? What do they like? What do they not like? Like, what you choose, how you choose to treat something isn't just like, I look it up in a book and it tells me to do this. We always say, like, the art of medicine. So there's a little bit of an art form to it, and you're using that artistic piece, if you will, to really individualize the treatment to somebody. So something that might work really well for person A is just not going to work well for person B, and it's dependent on their characteristics and their life circumstances, and that's where the it depends comes in all the time.
So there's not like one thing that everyone does wrong and everyone should see a physical therapist for?
Yeah, I would say there's some common ones.
Oh, are there?
But there aren't. I mean, most people don't have the greatest posture. Most people don't lift things well off the floor. Yeah.
I'm just going to sit up a little more when you say that. Yeah. And lifting things
most
off
people
the floor.
sit too much. Most people don't exercise. There's lots of things that most people do, but that's never all people. And what exactly it is that needs to be tweaked really varies. Yeah.
Well, I think a lot of times people think of physical therapy treatment as something that comes after an injury or surgery. Yeah. But it sounds like chronic pain or chronic living in a way can bring you to need it also. So how does someone know that they're a good candidate?
Ooh, good question. So I think I always say, like, if you've had a change in the way you move or your ability to move, that is a good time to come see a physical therapist. So if you are struggling when you previously weren't, that is a good time. If you're going to start something new, like you're going to train for a marathon or you're going to get a new job that has really different demands, those are also a good time to visit a therapist just to prevent issues. If you have a new diagnosis, I treat a lot of people, maybe just one visit because they have a new diagnosis of something like osteoporosis or diabetes, where it's like, can you just check in and let the therapist take a look at you and sort of tell you what you need to be working on to prevent the issues that happen with those diseases, just with aging in general, as unfortunately I'm experiencing, right? There's just these things that come along with that.
That's new.
So I think it is always easier to treat it early than it is to treat it later. So I always, to me, if you have questions and you're not sure what to do, that's a great time to come to a physical therapist to find that out.
Okay, great. All right, we have another question via Twitter from Charlie. What role do PTs play in the process of helping people wean off opioids?
Okay, great question.
Yes, thank you, Charlie.
So I think, obviously you're going to be working with your physician to do the prescription of weaning, right? But there are all kinds of factors that your physician will take into consideration in terms of how fast that wean happens. And that has to do with how freaked out are you by the weaning process. If you're really freaked out, we probably need to go a little bit slower. If you're really scared. And if you're in pain, that is a completely legitimate reason to be scared, right? And so physical therapists, we really play a role in supporting that because we're seeing you more frequently. So with my patients who are weaning, I'll ask them how it's going. I'll ask them if they're doing it, if they're doing it successfully, if they are able to stick with the weaning program. Sometimes they're weaning faster, in which case I'd let their doctor know, and other times they're really having a hard time with it, and I might call up and have a discussion with the doctor that they're sort of explaining why they're struggling, or maybe suggest that they follow up with their doctor, sort of depending on what's happening. But I think we play a big role in providing alternatives, right? So you can't just take somebody's opioids away and then give them nothing. That's generally does not work well in the weaning process. So we are trying to sort of fill the gap for them with some other techniques for pain management. But we're also there to kind of help alleviate some of those fears, answer some of the questions, help them figure out, when you first start weaning off opioids, there's usually a small increase in pain, but that's followed by either return to the way you felt before or even getting better. But hanging through it through that first increase is scary. I mean, it's really alarming for people. So we're there to sort of say, this is expected. If you can just hang with it a little bit longer, I think you'll see the benefit. Just informing them and keeping them informed and keeping them encouraged, I think that's really important.
Yeah, it sounds like managing expectations is an important part of what you do.
Yes.
Do you find that people are really responsive to that's an important part for them?
Yeah, I think if you're going to do something with somebody that's difficult, I mean, PT is generally considered hard, right? It takes time, and you have to actually do exercises, and you have to do stuff when you're not in PT, and you have homework, and it's just it's not super sexy, right?
Right.
So I think just giving people a very realistic idea of what that's going to be is extremely helpful, because if you're just ask, and you're sort of not explaining why, and the patient's not expecting this much of an ask, then it's really hard to get buy-in. So I think if you can tell people, this is what's going to happen, here's the deal, this is what's going to happen, this is the part you need to play in it. I can, we can come in here and do this all day long, but it's the stuff you do at home that's really going to matter. And sort of giving people a really realistic expectation. If you do this more, that's how you get better faster. If you do it less, you're going to get better slower. And we can still work with you. I'm still here for you. We'll help you piece through it at whatever pace you can handle. But, really being transparent and upfront about what the expectations are from that patient. I think that really helps, because they can kind of get their mind right. They can think about it, and then they can also tell me I don't think I can do that. I don't have enough time for that, or I don't think I can't bite that much off right now. And then I can say, well, let's narrow it down this way.
So that's okay. They're allowed to say that this isn't working this way for me. Is that part of their role? Tell me about what you expect in a way from your patients.
So I appreciate it very much when my patients are, frank with me, I'm not going to do that exercise, Sarah. I hate it, and I'm not going to do it. I'll be okay, I will pick a different one.
Okay, so you're not offended personally?
I will not be personally offended. Yeah. I mean, I think we have to be we're here, we're dealing with we're dealing with real pain. We're dealing with real limitations in mobility, and I always tell my students, however stressful it is to listen to somebody, remember, you're just sitting there listening, your patient's the one living through it.
Yeah.
So just get out of your own head with it and just help, and if the patient has a problem this big, but that it can only handle this much help, just give them that much help. You're not, I think a lot of us get into healthcare because, we want to help people, and we get kind of discouraged if we're well, it's this big and I can only help this much, and then you don't feel good. But I'm it's not about us, it's about the patient, and this much help is that much help. It's better than no help at all. And if the patient has some successes with that, they might be able to tolerate more and more things as time goes on. So I think you do need to be patient with people, and you have to meet people where they are.
Right,
Yeah.
and you want them to tell you where they are,
Yes.
so that you can meet them properly.
Yeah,
Yeah.
And sometimes that's hard to put into words, but I think there's lots of ways that patients indicate that. I think I always teach my students, be responsive to nonverbal cues. Like a patient shouldn't have to tell you, "I want you to stop that." If they're like you should pick up on that. Yeah.
And what's something someone could expect at an appointment, at a treatment? It's not like a massage, right, where you're just lying there. No. What's happening?
All physical therapists have fought that.
Yeah, I'm sure.
Reputation, but so what we'll do is we'll ask you a whole bunch of questions, kind of like I alluded to before, about like, what are you doing? If your shoulder's hurting, I'm going to want to know, what is that shoulder up to all day long? What are you doing with it and to it all day? I'm also going to want to know how you feel about it, what you're thinking, what you've tried, how you've tried to manage it, what you believe makes it better and worse, because I want to make sure that that's accurate, right? So we'll ask a whole lot of questions about like what's going on and what the patient's thinking is about that, and then we'll do an assessment. So like, how's your balance? How's your strength? Is anything tight? Is anything weak? Is anything, how's your alignment? How's your posture? If you have a job and you're stocking shelves, I'll probably watch you. I'll give you a weight and just watch how you do it. And if it looks like this, I'm going to want to tweak that.
Okay.
So we really try to get an idea of what's going on, and then then we're just sitting there sort of plotting how to diminish stress and strain on the ouchie part, basically.
Okay. Right. And so people have homework and exercises, but it's more than, and they have to, it's best if they do the homework, I'm sure.
If they do it.
But it's about more than just the homework, right? It's about your whole life. What are you hoping that people will do with the things they learn from you?
So the exercises, I'm hoping, so I give them some exercises that they're doing kind of temporarily. I think it's unrealistic to think that people will do them forever and ever. But there are some changes that we'd love for them to do forever and ever. Like, I would love for you to be active forever and ever. Maybe I don't really care what it is. Like, if you tell me what you're willing to do, because exercise is hard. Regular exercise is hard. So I always tell patients the best exercise is the exercise you're going to actually do. Like something you like enough that you can actually manage to do it on a regular basis. And then whatever that is, I will help you do it safely. I'll find a way to make it work for you so that we can do it safely.
Yeah.
And so that might be changing, like my example earlier, it might be doing it like this instead of doing it like that. It might be changing your positioning, but it might also be just changing the way you pace things. So maybe I have patients who, they clean their entire house and it flares up their pain. So I might say, well, can we do just one room? Or can we do just the vacuuming and then take a little break and then maybe do things
or later?
Yeah. So we work a lot on moderate, which is hard for people because people are like, I'm doing it all the way or I'm not doing it at all, and trying to like get patients to like, could we do it medium? And it's it's also not an attractive idea. I don't want to do it
right
half.
down the middle.
I want to do it all.
Right.
Or I just want to rest. So we do a lot of negotiating, but I think once patients start engaging in those sorts of things, they're like, oh, I feel better, and then they can go and apply that to other things. So I think what I really hope from patients is they actually learn about their bodies and about movement and about their pain, so that as they go through life and they approach different situations, they're like, oh, I know how to handle this, or I'll bet that's going to flare me up if I do it like that, so I am going to do it like this. Yeah.
Right. And then there's your voice in their head.
Yes.
Yeah, that's great.
Yeah.
What are some of the barriers to choosing PT?
Barriers to getting into PT?
Yeah, what's holding people back? Why do we need to tell them to?
So I think a lot of times people are kind of scared to come to PT because they think we're going to hurt them, and they're pretty sure we're going to make them exercise,
yes.
right?
So are you going to hurt them, and are you going to make them exercise?
So we are going to get them more active, and that is our job.
Yep.
And it's also good for their health, right? I mean, there's a reason why we're doing that. But we can take that at a really slow pace, and again, mentally and physically and emotionally, we're meeting our patients where they are. So if you can only tolerate this much, we'll start there. and we'll get good at that. And then we'll, I always say the goal is to like raise it by such small increments that your body doesn't quite notice. You have to sneak it in there. But I think slow and steady wins the race, right? So if you are here and you try to go here, well, maybe you don't have enough strength, balance, length, all of the things to do that. So, but if you get there gradually, you're building those things as you go, and that's a much safer way to do it. So, yeah.
And what about the time commitment? My guess is that it depends.
Well, there is a time commitment with PT, and it's like going, you're going to an appointment a couple times a week, and that's a lot. So, what I always do is work with patients. If you give me a time constraint, I'll just work within the time constraint. Maybe that's not going to get you better as fast as committing more time to it, but if that's the time you have to commit, that's what we'll work with. And I think a lot of people, either don't go to therapy or kind of fall off after they've started because they're like, oh, it's just too much time. And that's when I'm like, you need to share that with your therapist so they can work around whatever your constraints are.
That's great. Sarah, before we go, can you share how you've seen people's lives improve?
Yeah, I think I'm going to echo what I said earlier, which is that like when I get patients who really are like, oh, okay, the body mechanics, and it's when they start coming in and saying, I was doing this and it was painful, and then I decided to do it like that all by myself. And I'm like, yes, that's perfect.
That's great.
That's when I'm like, good. You're like on. That's when I feel like, oh, you're ready to flap your wings and get out of the nest. And so I think really learning the information and having the tools to really do what you have to do in safe ways. That's really our goal, and that's what I want patients to do. And that's when I've seen patients who are really successful, that's the kind of thing they do. And they'll come back. The clinic that I work at's in a community, so people have the opportunity. They'll be like, oh, I was in the neighborhood and I just dropped by to see you. And they're like, oh, I'm still, working on my posture. I had one person that's like sweeping the floor using like a wheelie stool. Like, I'm still doing that. It's helping a ton, and I still feel great.
That's great.
That's wonderful. And sometimes people are coming in like, I've been feeling great for all this time, but I just wanted to stop in because I'm having this one little thing and I wasn't sure if I should do this, that, or the other thing. So they've already had this whole thought process about it, and I'm just kind of helping them with a little bit of decision making, and it's like a quick visit. Whereas before, for that person, when they didn't know how to handle it, it probably would have blown up into a big problem.
So they're really improving their own lives after they've met with you.
And they're really able to, obviously that's not everybody. I wish it was everybody I treated, but it's a good portion of people. And I think really learning the skills of taking care of it on your own, and also kind of like gaining that self-confidence, like, oh yeah, like I can manage this. I know what to do. And that's what I love to see. I never get tired of that.
That's terrific. That's really great. Well, it's really inspiring and great. And for more information, now that people know all about it, people can check out moveforwardpt.com, which is packed with great advice and resources. And so, Sarah, is there one last word or two you'd like to give us on physical therapy treatment before we finish up?
Yeah, I think the key, you need a physical therapist when your movement has changed in some kind of way, or when you're planning a change in movement, and to just remind everybody out there to kind of share what you're thinking and share what you're up to with your therapist, and to know that even if at first there's some asks, if the therapist is asking you to do something that you're not comfortable with, or you don't like, or you just simply can't fit in, just to really tell us and ask us to work around that, and we will. We're happy to meet you where you are.
Thank you. Thanks everyone for being with us today.
Okay, thank you.